So now we have changed the wand. It's a new wand now, and we'll again start at the setting of 9 for aberration. Keep this aligned to maximum, please. Low maximum, please. Again, I'll start from the superior boundary. Superior boundary is the periosteum below the sphenoid bone. Alright, let me remove this tissue. Periosteum below the sphenoid bone, and will completely clear up the superior boundary. And you can see these are all lymphoid tissues. This is the lateral boundary. This is the lateral boundary. Torus tuberous, remaining 5 mm away from the eustachian tube orifice. The superior boundary, lateral boundary, and the posterior boundary all will merge into this place, which is the fossa of Rosenmuller. I'll not open up the periosteum, but remove the lymphoid tissues completely below the periosteum. That's the fossa of Rosenmuller. That's the posterior boundary, the buccopharyngeal fascia. You can see things very, very clearly if you have a good endoscopic camera or vision. Now, you can clean the tip of the scope by just touching it on the tissues as I just did, so that you don't have to come out again and again. And that's the lower part, which is the passavant's ridge area. So that's the buccopharyngeal fascia, which is not supposed to be opened up. We only need to delineate it. Remove all the lymphoid tissues on top of it, but not open up the fascia. That's the fossa of Rosenmuller, the lateral boundary in the posterior aspect. This is the torus tuberous, the lateral boundary in the anterior aspect. Again, whatever lymphoid tissue is there, I'm removing completely. But when I go in the area behind the torus tuberous, I turn my wand medially so that if at all there is an aberrant carotid, I do not blindly ablate over that. Right? Every bit of lymphoid tissue has been taken care of without opening up the fascia. So in the extreme areas and lateral areas, you can, if you do not want to ablate this, you can simply coagulate. In the depths, if you are not sure, you may simply coagulate so that this tissue will never hypertrophy. It will get fibrosed. Obviously, it's not as good as ablating, but even if you in the depths, I am ablating here, but I just showed that you can also leave behind some tissues after coagulation. So these are the boundaries of the adenoidectomy. Thank you for watching.